Now, the plane carrying South Africa's first batch of COVID-19 vaccines is expected to arrive in the country on Monday. That's tomorrow. An undoubtedly historic moment in the country's fight against the pandemic. Health Minister Zweli Mkhize says 1 million doses will be arriving from the Serum Institute of India. Slindelo Masikane is tracking the developments for us, and she joins us from our Johannesburg newsroom. Sli, take us through how the vaccine is expected to arrive here in South Africa.
Well, Masejo, we know that the countdown is officially on in terms of the procurement and arrival of the first batch of AstraZeneca vaccines coming from the Serum Institute in India. What we know from the briefings that we have had from the Health Ministry earlier this week is that that particular flight is supposed to leave India today and make its way via Dubai to make landfall in South Africa to the O.R. Tambo International Airport on Monday. We know that the media will be advised closer to the time on the exact details of that arrival so that we can be able to document the first batch of these 1 million doses of vaccines to make landfall here in South Africa. After that, we know that the vaccines will have to undergo what we know to be a technical process of quarantine as well as quality assurance. Now, this means that the vaccines will then be put in a safe place to be tested for a minimum around 10 to 14 days. This is how long it's going to complete to take this quarantine process, and then there will be a national rollout of these vaccines to the provinces.
All right, Sli, tell us a little bit more as well about what happens after the vaccines arrive here, the rollout plan, etc.
We know, of course, from previous family meetings as well as from the Health Ministry that the rollout plan is to take place in 3 phases. Now, the first and the priority for the vaccination process to begin with is the frontline workers, and that is our healthcare professionals. They are the first that will be getting the first jabs of these vaccines that are coming to South Africa tomorrow. And then we know that in phase 2 of this particular process, we're going to have essential service workers that are going to be prioritized. So that's your teachers, your police officers, municipal workers rather, as well as other frontline personnel. We also know that those in institutions like old age homes, shelters, as well as prisons, and people over the ages of 60, as well as adults with comorbidities, are going to then take part in the second phase of the rollout. At that stage, we understand that the plan is to reach around 60 million South Africans in the second phase of the rollout. The third phase of the rollout will then be to other South Africans who want to be vaccinated. We must remember that this is a voluntary process. People are not going to be forced to be vaccinated, and that particular project will then, of course, take place throughout the year. And we know that the South African government has engaged with 3 different ways of procuring this vaccine. That's through the COVAX facility, as well as an initiative from the African Union, as well as speaking to actual manufacturers themselves. Because for us to be able to get herd immunity, we're going to need at least 40 million South Africans to be vaccinated. So while the 1 million doses that we are expected is welcomed, it's still definitely not enough for us to be able to get that herd immunity that we need.
Of course, and what are some of the challenges that government may face in the vaccination process?
So firstly, it is, of course, getting enough vaccines into this country to be able to vaccinate at least 40 million South Africans. We know that a number of developed countries are almost hoarding when it comes to the vaccines that they have. They have too much, in fact, for what they need. And there has been an appeal from the South African government and the president himself to these countries to release some of these vaccines to developing nations like South Africa that is now, of course, experiencing a variant of the COVID-19 virus. And so what we also know is that, of course, it's one thing to procure the vaccines. It's another thing to get South Africans to actually take the jabs. And we know there's been a lot of anxiety and rumors, as well as false information around what these vaccines entail and the side effects. And there's just going to need to be an education drive. Many of the medical experts are saying that South Africa needs to now step up in terms of their campaigns to ensure that people are educated on the vaccines and what they will do and why they're so necessary in order to fight this coronavirus pandemic. And what we've heard from experts themselves is that if government officials are appealing to South Africans to take these vaccines, we might have to actually see them taking these jabs themselves, actually being out in the public, inviting the media to be able to document them actually taking these vaccines themselves to ensure and to reassure South Africans that it is safe to take these vaccines. And so I think over the next couple of weeks, we're also going to have to see how South Africa is going to procure those enough doses in terms of being able to fight this pandemic adequately.
Well, thank you very much. Of course, that's my colleague Slindelo Masikane coming to us live from our Johannesburg newsroom.